Hi, good day. My name is Kian Jubila Cartiza Bulanon from DSTM1A. So for today's video, this will be our final project from Ma'am Jaline Rosetta. So I'm going to compile a video of a proper procedure in responding first aid. So this will be the following: choking, primary survey, burn, CPR, and heart attack. So we must watch and learn. So nothing further ado, let's go to the video.
First aid, an aid when it matters the most. You could be a lifesaver with just a little correct information. You need to act or give first aid immediately in some situations. Let us discuss one such scenario: choking.
Hello? What? Don't you understand deadlines? Your cutoff is tomorrow.
Ask if the person is choking.
Are you choking?
If the person is not able to speak, reach around the person's waist from behind. Make a fist and press your fist into the person's abdomen and give 5 quick upward thrusts.
Are you choking?
Ask if the person is choking. Reach around the person's waist from behind. Make a fist. Press your fist into the person's abdomen and give 5 quick upward thrusts. Repeat upward thrusts until the object is forced out. If the person becomes unconscious, he needs to be given basic life support immediately and taken to a doctor. A person chokes when the airway is partially or completely blocked. Unless given first aid, the person may die.
In this video, we will teach you what to do if you found someone collapse. The initial assessment is called a primary survey. This is a quick, early assessment to establish how best to treat a casualty in order of priority. We can use the initials Dr. ABC or DRABC to remind us of the steps we need to follow. These initials stand for danger, response, airway, breathing, and circulation. So, when I see a casualty, first, I'm going to check for any danger to make sure it's safe for me to approach them. I don't want to become a casualty myself. Then I'm going to see if I can get a response from the casualty. As you approach, introduce yourself. Ask them questions to try to get a response. If they're not alert and do not respond to your voice, kneel down beside them and gently shake their shoulders. Hello, Amy. It's Winston. Can you hear me? Open your eyes. Still no response? You can pinch their earlobe to see if they respond to pain. Depending on how the casualty responds to you, will establish a level of response. We use the ABPU scale, and each letter can represent the casualty's level of response. A, alert. V, response to voice. P, response to pain. And U is the casualty unresponsive to stimuli. If there is still no response, they are unresponsive. We need to check the airway. Is the casualty alert and speaking to you? You know that there is no problem with the airway, it is clear. If the casualty is unresponsive, open the airway by putting one hand on the forehead and gently tilting the head back with 2 fingers under the chin. Now we need to check to see if they are breathing normally. We do this by placing our ear and cheek over their nose and mouth, looking down the body to see if the chest rises and falls. We do this for 10 seconds. If the casualty is not breathing normally, call for help. Ask them to call 999 or 112 for emergency help and bring an AED. If you are alone, call for emergency help using a mobile on speakerphone and begin CPR with chest compressions. The casualty is breathing normally, so I'm going to check their circulation. Are there any signs of severe bleeding? Look and check down the body. If you find severe bleeding, try to control the bleeding to prevent life-threatening shock. Call 999 or 112 for emergency help before continuing to treat the casualty. You may also need to treat them for shock. I've established that my casualty is not bleeding. So remember, to do a primary survey, follow the order of Dr. ABC. Complete each step in that order as quickly as possible, dealing with any life-threatening conditions as you find them. Call for emergency help. Call 999 or 112. And that's how we perform a primary survey.
Burns can be caused by exposure to flame, heat or other forms of radiation, contact with hot or extremely cold objects, liquids or gas, or contact with chemicals. There are three main classifications of burn injury: superficial, partial and full thickness burns. A superficial burn is where only the top layer of the skin is involved, such as sunburn. This usually heals well and should not require medical attention unless it covers more than 10% of the body. A partial thickness burn is where the top layer and second skin layer is damaged, giving rise to rawness and blisters. These burns require medical attention. A full thickness burn includes both outer layers of skin and the underlying subcutaneous tissue. Urgent medical attention is required. Move the casualty to a safe environment. Immediately cool the affected area with slowly running cool water for up to 20 minutes and remove all rings, watches and jewellery. With large burns, only the affected area should be cooled, as there is a danger of the casualty suffering hypothermia. Clothing stuck to the skin should not be removed. Elevate burnt limbs where possible and cover the burnt area with a clean or sterile non-stick dressing. In major burns, fluid loss and pain can cause life-threatening shock. Where burns have occurred to eyes or a chemical has been splashed into them, they must be flushed with cool, flowing water for 10 minutes, 20 minutes for chemicals. Both eyes should be covered with an eye pad and medical attention urgently sought.
Hi, I'm Josh. I'm a nurse here at Children's Hospital Boston Emergency Department. It's summertime and children and families are out playing, especially in the water. And here at Children's Hospital, we are seeing a rise in water-related emergencies. So we thought we would take a moment to review the steps of basic CPR with you. The first step of CPR is to assess if the person is awake or not. Are you okay? Are you okay? If there's no response, you should shout for help or send someone for help. If no one's available to help you, you must act. Time is very important when trying to save a life. The first thing you want to do is remove the clothing so that you can work. Open the airway by doing a head tilt chin lift. You want to lift with your fingers on the chin and hold the head at the forehead with your other hand. And you want to lean in and you want to look at the chest, listen for breathing, and feel for any breath against your face. And do that for about 5 to 10 seconds. If there's no breathing, you need to give 2 breaths by pinching the nose and making a seal against the mouth. You should see the chest rise with each breath that you give. The next step is to check for a pulse by using 2 fingers on the side closest to you. You should check for a pulse for about 5 to 10 seconds, and if you don't feel a pulse, you need to start with compressions. Place the heel of your hand between the nipples on the chest, right over the breastbone, and interlock your fingers together. And you should push 1/2 to 1/3 the depth of the chest. And you should do 30 compressions. 1, 2, 3, 4, 5. As a nurse, I've taken care of many children that have come to us after suffering a near drowning, and they've been pulled from a body of water and had CPR performed by family and friends. Knowing just a few basic steps of CPR might help save your child. 9, 30. Continue with cycles of 30 compressions to 2 breaths for 5 cycles. And if help hasn't arrived after 5 cycles, you can leave the child to phone for help. When you return to the child, you should continue with compressions and breaths until professional help arrives. And remember, this is not a substitute for a formal CPR course. We urge you to sign up for a course in your community, and you may be able to save someone's life.
A heart attack can strike at any time and place. The first symptom that manifests during a heart attack is a feeling of breathlessness and discomfort. One might also feel sudden pain in the chest, upper abdomen, upper back, shoulders, jaw, etc. Increased sweating can be noticed, and in some cases there may be nausea too. Prominent signs of a heart attack are breathlessness and anxiety, chest pain, sweating and palpitations, nausea. When you notice someone experiencing a heart attack, call out for help immediately. Call an emergency helpline equipped to deal with heart attacks. Assess the victim for a response and look for breathing. If there is no response and no breathing or only gasping, check for pulse. If you do not feel a pulse within 10 seconds, perform 5 cycles of CPR. Lack of blood supply to the heart muscles causes a heart attack. Time is critical in such a situation. All types of chest pain need evaluation in a hospital capable of managing heart attacks. Symptoms of a heart attack. Prominent signs of a heart attack are breathlessness and anxiety, chest pain, sweating and palpitations, nausea. Call an emergency helpline equipped to deal with heart attacks immediately. Time is critical in such a situation. Effective treatment instituted within 1 hour can lead to complete reversal of the damage suffered. Help the patient sit down and remain calm. Make sure that the patient continues breathing and has a pulse till the ambulance arrives. If there is no breathing or pulse, perform CPR.